My question is relating to the daily reporting, the reporting of the daily case count. So with the move from PCR testing to ART as the primary mode of testing, would MOH still be reporting the daily case count? And if not, how will we continue to have an accurate picture of Singapore's COVID situation if the reported daily numbers doesn't capture all cases, since most of us are going to be using ART going forward? Thank you.
Thank you, Janice. I think this is a question that many people might be interested in. We continue to track all cases that are brought to our attention that are important to us as well. And reporting daily counts would still remain at this point in time. But increasingly, as time moves on, we want to focus on what is more important. The majority of people have very mild infections or are asymptomatic. They have an excellent course. They don't have any complications and recover very uneventfully. What we want to focus is on then that remaining 2% of cases that do have additional high-risk factors who may end up requiring care in our hospitals or community treatment facilities. They may require oxygen supplementation or even admission into the ICU. So we will progressively focus a lot more on these numbers because these are the people who have more severe infection that do require more care, more utilization of our healthcare resources, and we need to invest a lot more to making sure that they have as best an outcome as is possible. So progressively, we will shift our mindset towards focusing on those who do need our care. And while we continue to track how the epidemic is going, how the community cases are going, but we'll be relying on different indicators, not necessarily only PCR test results and reports on its own. We continue to maintain our sentinel surveillance in the community, and this will give us a good sense of what the situation is like in the community when we look at the people who report or present themselves to GP clinics with respiratory symptoms, and it will allow us to better understand what is the prevalence of COVID-19 infection, how it is spreading in the community, and whether or not it's giving rise to clusters of cases in various different settings. So we will track this, but we are going to be looking at a wider range of indicators to have a better reflection of what the situation is, and we will be focusing more specifically on those where we do need to invest more care, more attention to assure a better outcome for them.
If I may make a last remark. What's the difference? The top line, which is the infection number, comprises many people now vaccinated, mild or no symptoms. And we monitor that number to the best of our abilities. But they are mild or no symptoms, many of them, great majority, 98%. The bottom line is where lives are at stake. People who died, people who are in ICU or requiring intensive care. And this is where I believe our focus should be, as Kenneth had mentioned. And we will continue to try our best to care for all of them. For the 142 that have passed away, I think the MTF, all of us, extend our condolences to their families. And for others, MOH, all our hospitals, all our medical personnel and healthcare workers, we will always do our best to give you the best possible care and do our best to make sure that nobody is left without proper care. Thank you.